So I'm gonna place the implant in the proper position, and then if there's some thread showing, I'm gonna do a grafting on it. Because a lot of times what you guys do is you guys just follow where the bone is, you sink it all the way down, which works well, but then cosmetically it's gonna look terrible. And so
when I do say things on the occlusal part of it, like bone is pretty, you do it, make sure that you take care of your papillas, that you're not on top of it.
Me and her gonna fight. She used to love me. A bit more mesial and tilted because I have it going perfectly with the.
It exceeded my expectations. I'm super happy that I did it. I feel confident now that when I go back to my practice, I'll be able to place implants with no help. One of the things that I think was the most important thing is that we were able to place not only 1 or 2 implants, but 10, which gives you, like all scenarios of possibilities that can happen in the surgery.
We really focus on the current technology, the modern technology, really utilizing CPCT, CEREC, and everything else that we have at our disposal to work together to make it a more safer environment for the doctor to place the implant safely. So they know now what the process has to be done.
To see the class from a restorative and surgical portion different and then together, I think that's what makes it different from all the other classes that we have seen. From a specialty point of view, sometimes we come in and we say these things and they're like, why? Now they know better, they're gonna teach their associates better, and there is gonna be like a more close bond between the periodontist or the surgeon with the general dentist.
If anybody's on the fence about joining the class, by all means, 100% you should do it. You have the knowledge that our teachers have gained over the years. They're willingly sharing with us in such a short period of time, something that we're not gonna get anywhere else. Not only I learned the clinical skills to place implants, but also the challenges that come before. We have to prepare case selection and to expect the unexpected, because the surgery will never go as planned.
I mean, for me personally and professionally, placing implants was really kind of the last tool to my toolbox. So when signing up for the course, it was just something that I could add that value to my patients. And patient comes in and they're missing a tooth, I could add that value that day.
The implant training and especially the live surgical sessions gave us insight that we wouldn't have the opportunity to learn from in any other situation. Having that in-the-moment feedback and coaching from Dr. Valdivia and Dr. Pham in the situations that we don't really have a lot of familiarity navigating was invaluable. And then also being able to provide our patients with the opportunity to receive the best treatment possible, implants, if they might not normally be able to afford it in regular circumstances. 2 factors that really are assets to this workshop and live training experience.
I truly enjoyed this class. If you're on the fence about taking it, if you think, oh, is it really worth it? Yes, it's worth it. If you want to be able to provide the service to your patient and also be that dentist that you said you were going to be, you need to do this class.